Happy Migraine Awareness Month, everybody. Our theme for Migraine Awareness Month this year is Your Migraine, Your Way. And that means taking control of your migraine journey. Now, to do that, you need to understand some of the risks of migraine, but then know enough about them to not be scared of them. So one of the ones we're going to talk about today is that slightly higher risk of stroke that people with migraine, and particularly migraine aura variants, have. To do that, we've got Dr. Dennis Cordato joining us. Thank you for joining us.
Thank you for asking to speak with you.
That's okay. You were actually recommended by one of your patients, which is always a good vote of confidence, I think. All right, let's start at kind of the basics. What is the risk of stroke for people living with migraine?
This is controversial because there's different ways of trying to understand the risk. If you look at the basic literature on this, compared to the general population who are not migraine sufferers, there is an increased risk if you go through all the different literature. It's probably, we're talking maybe, they call it a 30% difference, but when the normal population's risk might be, say, 2 in 1,000, a migraine sufferer's risk might be 2.5 per 1,000, for example. So it's a very minimal real increased risk. Like the absolute increased risk is quite small.
So what does that mean in real terms?
Does that clarify?
Yeah, so like the risk of having a stroke generally is pretty low.
What you said, relative risk might be 1.3 times the normal population risk, for example, and that's a slight increase in risk. It's not quite double the risk, and there are caveats to that. Like I think the risk does depend on other things. So you can create risk. So if you smoke and are a young woman and have migraine with aura, you do increase your risk beyond that. If you take the pill and smoke and are a young woman, you increase the risk a bit further. But there's a lot of controversy because even whether or not you take the pill, the risk is quite small. That being quoted as being increased. So I think what you said is appropriate. It's a slight increased risk, but not really substantial enough to be worried about. It's more a statistical modeling risk.
Yeah. Okay. So what does that mean generally in terms of managing our stroke risk? Obviously, don't smoke. Good tip. The pill is controversial, and particularly that data is generally looking at the older types of pill, right? The combined pills. So the newer.
Because I think the dose does make a difference. Different forms of contraception, like the progesterone-based ones, I don't think that there's any substantial risk at all with those. So again, be guided by your GP. But newer forms of contraception, the risk is probably not. It may not be an increased risk.
Yeah. Okay. Which is good to know. In a general kind of way, is there any? What I'm trying to say is probably no data, but is there any kind of indication of the different types of migraine? Like, for example, I have hemiplegic migraine. So obviously, I have a lot of conversations about stroke with my neuro because my attacks look like a stroke. Am I at greater risk of stroke to someone that, say, gets visual aura, or is there no data?
I think we don't know the answer to that, but I think that from our experience and what we've seen with patients, that you're probably not necessarily an increased risk. I've had several patients over the years with hemiplegic migraine. They run a stereotyped course. They typically get better within a day, and there's no long-term after effects. They recover fully, and that pattern tends to stay even if they keep having attacks. So I think, and the same applies with migraine aura, like people that get visual auras with their migraines, they will typically fully recover. And when you find someone that had, say, a migraine aura or something that was akin to a migraine aura, the times that I've identified something going on where, say, the visual disturbance continued, we usually found there was something completely unrelated to their migraine as the cause. For example, they had a retinal problem, something like that. So if you do get something that is different to normal, it doesn't necessarily mean it's going to be a stroke. It might just mean that there might be some other process that you need to check out. But normally, if you have the same repeated event, I don't think patients need to, or people need to be too worried about it, because the normal pattern will be it'll follow the same process. It'll run 20-minute course or whatever it is, and then it'll go away and you'll be fine again. It's more, I guess, the quality of life impact that it has on it rather than the risk of a stroke that it causes.
For those who are concerned or are having some stroke-like symptoms, the real key would be, is this different for you? Yeah?
Correct.
Yeah. And if it is different for you, then go to hospital.
You can get a variety. And you can get a variety. I've had people with migraine auras where they normally get visual auras, and then one time they lost their speech. And they were worried, what does this mean? It's different to what I normally experience, but it's still within the realms of migraine that a migraine sufferer with auras can get different types of auras. They might have one predominant type of aura, but they could get sometimes another type of aura where there was numbness down one side or speech disturbance. And if it's the first time that ever happened, it's probably worth checking it out with the doctor and just making sure that they are convinced also that it was a migraine, not something else. And if it occurred in the setting of a typical headache event, in the same way as the visual, then it probably will turn out to be nothing to be worried about as well.
Okay, they're all good tips. So is there anything that we should particularly do or be aware of in order to manage our stroke risk, other than, those things that are kind of fairly obvious, like not smoking? Are they, other ways to stay stroke healthy?
I think that's probably where we should be focusing on, particularly people with migraine where they're getting older, is to address the blood pressure, cholesterol, sugar, and other risk factors. When you look at rates of stroke in migraine sufferers, so say someone who's had a history of migraine and they had a stroke, it's probably not related. It's not related to their migraine, it's related to their vascular risk factors. It's related to maybe they were diabetic and it needed to be better controlled, or maybe their blood pressure wasn't optimally controlled, and the migraine really didn't contribute to why this event happened. And when you look at, I don't think that the migraine has a significant relationship to why they had their particular stroke. It was more to do with their lifestyle and other factors that was relevant. And the same with any other disease.
Yeah. Okay. So there is one type of stroke that can be caused by migraine. This is the migrainous infarction, as it's called. This is really rare, isn't it?
Yeah, it's extremely rare. And I think I've discussed this before we had this webinar, that I possibly have had one patient in my whole career where I was of the opinion that was the reason that they had their stroke. But even there, it's controversial whether it was. So by and large, migraine stroke is very rare. But the other thing that, if you look at the literature on just for the one last point, was if someone did get told that they had a migraine stroke, often you look at their outcomes, they still do quite well. They don't necessarily have a devastating event, but it's extremely rare.
Alrighty, thank you so much for making the time. We'll let you get back to your patients.
Thank you. Nice to talk to you.